My name is Allison Golden,
I'm Amanda Harbridge.
and today we're going to be talking about the Advocacy and Resource Center. Specifically during our presentation, we're going to be discussing the definition of our chosen agency, including who they serve, mission and values, mission and vision statements, current issues and challenges, interview highlights, and history. We're also going to be discussing two social problems within our chosen agency, along with the impact of these problems. And we're going to be touching on some strategies and approaches that can help alleviate these problems that may impact the community, organization, or agency functioning. So what is the Advocacy and Resource Center? It's a non-profit public agency that provides support and assistance to those diagnosed with a developmental and intellectual disability. The ARC has chapters located all across the United States. Specifically in New York, they have chapters located in Clinton, Monroe, Benton, Yates, Ontario, and Franklin counties. The mission statement specifically for Monroe County, which is the organization we assessed, is to empower people to live their best lives authentically and reach their full potential within a progressive community. Their vision statement specifically discusses how they focus on supporting people to live their best lives and focus on their infinite possibilities. And they emphasize that they never set limits on boundaries on others and believe that everyone has the ability to achieve um, whatever they want to. So some history of ARC is that it actually started as a grassroots organization founded by parents in the 1950s. Their children weren't being offered as much support, and so they founded this organization to help support their children or find support. The first name of the ARC was the Association of Parents and Friends of Retarded Children, and it was the first organization to fund research on the developmental disabilities by offering monetary donations. They have advocated for the implementation of supplementary service income for individuals who are unable to work. They have advocated for the expansion of Medicaid and Medicare programs, and they helped to create the Supported Employees Protection and pushed Congress to aid disability as a protected class under the Fair Housing Act. There's a current president of the ARC of Monroe, Tracy Petracek, and there's also currently a board of directors responsible for funding and allocating resources. So current issues or challenges include communication and high turnover rate. Communication seems to be occurring from the top down, and the high retention rate seems to be causing them to lose staff more, and they're not able to keep hold of staff. Both of these issues can be caused by the high pressure environment of this current social problem. Not social problem, could be caused by the high pressure environment of this organization, having to constantly think on your feet, having to constantly move quickly from one place to another. It can cause stress and burnout. If it's not being properly advocated for, it can cause other issues as well. And then we're going to be discussing some interview highlights.
Highlights from the interview with a manager from the ARC of Monroe County include staffing issue, communication issues, and instances of staff mistreating clients. When asked about challenges within the agency, the manager mentioned staffing is a challenge in finding and keeping staff. Recruiting and retaining staff appear to be a significant challenge for this agency. When asked about the challenges she faces as a manager, she stated attitudes from staff, pushback after giving corrective criticism from upper management as well. This manager seems to be upset about the pushback and attitudes she experienced from staff and upper management. When we asked the manager what feedback did you get from client staff or clients that signal areas of concern, she replied, communication is a big problem, miscommunication from the top down. Also, being mistreated by staff needs to be corrected or serious action is required. Staff splitting between staff. Communication is another key highlight from the interview.
And next we're going to be touching on two social problems that impact the functionality of the organization. We're going to be touching on staff splitting. So specifically, what is staff splitting? This term gets thrown a lot. It specifically is when individuals at a workplace intentionally create conflict or division among team members, and it may manifest in the following ways. It may look like taking control over, talking behind someone's back, or telling different stories to other people. So, how can specifically staff being rude to managers or people of authority and staff splitting impacts the functionality of an organization? So, staff splitting can cause a breakdown in teamwork, communication gaps, inefficient workflow, decision making difficulties, and a hostile work environment. Being rude to people in authority erodes leadership, reduces accountability, increases conflict, lowers productivity, and damages reputation. Um, Specifically, there are some ways that we can work towards alleviating these two social problems. For staff splitting, what we can do is we can advocate for conflict resolution training for staff. Some steps to implement this recommendation include to assess needs. So this would be to identify staff challenges and skills gaps related to conflict through surveys or discussions. The next step would be to plan training, set clear goals, and choose training material. Next, to communicate with staff about the training purpose, dates, and then fourth step is to deliver training, and then the final step is to evaluate and follow up, and just kind of figure out if it's working or not, or if there's anything you need to change. A way to alleviate the problem of staff being rude to people of authority is to set clear expectations for behavior. So some specific steps to implement this recommendation include defining expectations of behavior, creating a written policy for employees to base off of, communicate to staff about certain expectations you have, or yes. Um, Next is to lead by example, and then the final step is to monitor and provide feedback accordingly. These two strategies capitalize on the ARC's strengths, some which include empowerment, trusted advocacy, and community connections and relationship building. And then, what are some of your ideas to help alleviate some of these social problems? And thinking as a future social worker.
To address communication issues and high staff turnover at the ARC of Monroe, we draw on the system theory perspective in leadership strategies discussed in Kirsch-Dash, which emphasize understanding organization as complex systems with interconnected parts. As a future social work leader, our role is to implement sustainable strategies that improve both internal functioning and community impact. The identified issues are communication breakdowns between administration, direct support staff, and service recipients, and high staff turnover, leading to service disruptions, burnout, and inconsistent care. The problem-solving approaches would be to enhance communication, and the goal for this is to foster trust, collaboration across all organizational levels. The strategies and steps we would take would be assess current communication, have regular staff meetings and feedback loops, use digital tools, define what the protocols are, implement updated streamlined tools, train staff on communication, and we would monitor and adjust accordingly. The leadership roles would be to create a culture of open door communication and model collaborative dialogue. Second would be to reduce turnover through organizational support, and the goals for this is to increase employee satisfaction, stability, and professional growth. Our strategies and steps are to assess current protocol, onboarding, mentorships, programs to support new hires and prevent early burnout, recognition and appreciation programs to validate frontline efforts, accessible mental health support and stress reduction initiatives. Then we would monitor and adjust correctly to reduce turnover through organizational support. The leadership role is to practice transformational leadership, engage, inspire, and empower staff to feel connected to the mission. Third, promoting staff development and retention. The goal is to offer long-term growth and professional investment. Our strategies and steps would be to assess current staff needs, professional development plans like training and trauma-informed care, educational partnerships with colleagues to offer tuition assistance and field placement, career ladders that allow DSP and caseworkers to grow into supervisory roles, and we would monitor and adjust accordingly. Leadership roles would be to facilitate a learning organization that rewards growth and loyalty. Fourth would be to build community and organizational alignment, and the goals would be to ensure that organizational practices reflect community needs and values. The strategies and steps for this would to identify key stakeholders, community stakeholder meetings to gather input and foster trust, client and family adversary boards to promote shared decision making, policy advocacy for higher wages and funding at the county and state level to reduce systematic turnover. Celebrate community wins and maintain ongoing support, and we would monitor and adjust accordingly. Leadership role is to serve as a bridge between internal staff needs and external community expectations, fostering mutual accountability.
So specifically, we found that this company does an excellent job of supporting and working with the presidents. While talking to the manager, we could say that she's generally happy to see these individuals doing well and out and about in the community. There are some key strategies. There are some key systematic issues within this organization, including high turnover rate and communication issues. However, there are some problem-solving initiatives that can help alleviate these problems, including enhancing communication, promoting self-development, retention, and fostering communication and organizational alignment.